Hello and good morning, afternoon. I guess it's whenever you're watching this, but I did my presentation on rumination, which was an interesting concept we sort of talked about through a coping method associated with trauma. So my overview is going to talk about what is rumination, just as a review, how does it apply to trauma, underlying mental health concerns, what to watch for, and why it's important. Pros and cons of rumination, a couple journal applications that I found really interesting along the way, as well as some techniques and therapies, and my personal application. So let's jump right into rumination. So rumination is the brain's cognitive attempt to process through trauma. It's often cyclical, repetitive, and can become obsessive. It's the persistent sort of repetition around negative or harmful thoughts connected to the stress or stressor related to the traumatic event. So it's kind of like stirring in the pot, if you will. This occurs randomly. I assumed that this was kind of like a causation of certain personality types, but this is, according to everything I read, very random and intermittent. It can have higher instances associated with PTSD and baseline depression or history of depression. So causes of rumination include anxiety, distress, and it can cause setbacks in your ability to cope, problem solve, and move forward. It is often unproductive and considered maladaptive. It's the perpetuation and distortion of beliefs because of the trauma, and it is often tied to guilt and self-blame. It's a way that people try to rationalize the trauma. So I found it interesting because I thought that this was a cognitive process that was sometimes beneficial, and throughout this study, I will go into the pros and cons of where it can be effective and constructive as well as maladaptive. So how ruminating relates to trauma is basically that fight or flight response after a trauma where we can get stuck. And so coping mechanisms are used to understand and process through trauma. This is sort of the repetitive revisiting of the trauma instead of working through it or past it. It can prevent healing, and if long-term and unmanaged, it can be very harmful. It's a way to rationalize or attempt to explain the trauma. I don't know that that's necessarily ever a positive thing when it turns into self-blame or, thinking that the trauma that you experienced was your fault. But some patients try to grasp control of the trauma by sort of stewing in it, and then it becomes therefore deconstructive. So it can be maladaptive, obviously, and emotionally dysfunctional because it kind of repeats revisiting the trauma again and again and again instead of working through the trauma. There's a high instance of increased stress, anxiety, and especially with patients of depression and PTSD. So this can lead to disassociation. So if a patient ruminates for long enough, basically they can believe that the trauma or experience may or may not have been their fault, but sort of manipulates the context, and trauma begets trauma, right? So alternatively, however, and where I was mostly interested is that it can be helpful through the analysis of trauma and processing through those grievances. So underlying health concerns, what to watch for, and why it's important. I think that rumination disrupts mental health and individual well-being, and it is where some patients dealing with trauma get stuck. So it's highest in association, as I mentioned, with depression, anxiety, and PTSD following trauma. I think this also has a lot to do with how the extent and duration of trauma or the severity of trauma, the length it continues, factors into the scenario. but it occurs randomly, and anyone who experiences trauma is at risk. So things to watch for are low self-esteem, sort of those insecurities. Patients or people who are often in their head look for an explanation, and so they can kind of get stuck in that search. It can come with sadness, worthlessness, and helplessness. The victim of a trauma becomes victimized, if you will. It has a lot to do with irritability and mood swings. As a sort of comorbidity of patients who ruminate. And then concentration problems and distractions are often very common. Things to watch for are loss of interest or lack of motivation, sort of getting stuck, right? And the simplest things in what you're doing can then become overcomplicated if you're stuck in a rumination pattern. It often can be fatiguing and consume excess energy. So those are things to watch for. And most importantly, it can cause self-harm and eventually suicidal ideation. So I think rumination can be observed in patients who sort of obsess a little bit over the trauma and get stuck there, and often they share that sort of rumination on some level with their peers because they can't escape those thoughts, and so people around them often notice these patterns. I found 3 quotes that relate to the importance of why rumination and trauma are an important context. And so our text, I'll start off with first, which just says, our sense of safety and security are altered by trauma through experiences and emotions in dealing with primary and secondary traumas. So I thought this was a really great quote because whether we experience trauma directly or indirectly, we may be affected by trauma. It may change our thoughts and our perceptions. And so it's important to be grounded in our interpretation and our exposures. But sometimes when we hear even other people's traumas, we may be sort of shaken up a bit with our sense of safety and security. So I thought this was a really great quote that applied to the context. Another couple articles I stumbled upon were just in searching for journal reviews. And let's see, one of the articles is by Barsky, and it is what is rumination and how is it related to trauma. And it just says trauma is temporarily putting off the messy work of healing. And I do think that that's a great example of rumination and sort of getting stuck in that pattern of trauma, always relating to it, always thinking about it, not being able to separate from it. Those are all examples of ruminating. And so my last quote was from another article I found underneath the Center for Mind and Body Medicine, which was just an article on trauma and stress relief. And I thought it was very applicable that all of us have the capacity to begin to heal our traumas and relieve the chronic stress associated with trauma. Rumination is an example of something that might require a little more work, awareness, and supports for. So that's kind of, the underlying health concerns, what to watch for, and why it's important. Resources include awareness, reflection, therapies like cognitive behavioral therapy, counseling, non-traditional and traditional forms of medicine. I included social groups. Often patients share their ruminative thoughts, and so either with family or with friends or community and within group work can really be a turning point for patients who are ruminating. Lifestyle is really important in any form of trauma, and tending to sleep, exercise, diet, and stress reduction. Great way to do that is through hobbies and interests. And then there's education. I really like the idea of in circumstances or trauma or traumas that are experienced, like say women amongst a class of men as being perpetrators in certain environments, talking about it, being aware of it. I think more education should sometimes go into some of the things that women should watch for example, based on that scenario. Not to say that there's not others, but that's just the one I could come up with right away. So the next screen really is pros and cons. And the pros of rumination is that it's reflective. So it can play a role in the analytical process of working through trauma. And I think that's really important, and where the next slide I kind of tried to find journal articles that supported that. It can lead to seeking social support. So again, because patients get stuck, or people get stuck in that trauma, they tend to sort of be voiced around others, or it's noticed at a workplace or something like that. So I think that observation and awareness of rumination can really lead to seeking social support. The negative aspects, obviously, are far more common with rumination, especially without support and maintenance and help, right? And so that's sort of that negative context of what I called brooding. And so it's kind of ruminating, getting stuck in that sort of obsessive cycle. It's often associated with negative consequences, negative emotions, and negative behaviors. Cognitive disturbances include intrusive memories and disruptive thoughts. So really, they're stuck in that trauma, and that's kind of sad. And then there's physical manifestation and health and poor immunity. And so I think whenever someone is at a higher instance of stress, you're exposed to sort of a breakdown or a fatigue, whether it be physically, mentally, emotionally, behaviorally. And so that can lead to poor health over long term. The avoidance and disassociation with rumination can lead to maladaptation. And so these are extreme cases where, again, patients who ruminate just get stuck, and then they start to believe that, say, perhaps that trauma is then their fault. And that can be very counterproductive and destructive. It can lead to depression. PTSD is a common amongst patients who ruminate, as well as substance abuse. Trauma begets trauma, right? So if you're stuck in a traumatic cycle, if you're not processing through that stress, then you may repeat the cycle of just putting yourself in a vulnerable place to be re-exposed to that trauma. And so that's something for us to also be aware of. If something triggers us in a traumatic way, we should sort of work through why it triggers us in order to better serve others and those around us. So I, really tried to focus on journal applications here for less common positive associations. And I found two that I think were very clinically applicable. And so I'm just going to briefly review those. The concept, I guess, that I found from Direct Science Journal Clinical Psychology Review was that rumination can be used as a form of positive emotional regulation. And so I took a quote where rumination is conceptualized as a passive response, a maladaptive alternative to employing active instrumental responses, such as engaging in distraction or employing problem-solving strategies in order to sort of bolster, move, and effectively change one's circumstances. And so obviously I think this might be used in more of a either therapeutic or a supportive sense through counseling, but basically it's an example of where rumination and processing through that trauma and spending some time there, obviously with supports, I think can be used as a coping mechanism to work through a trauma. And so the differentiated strengths and weaknesses are between sort of the abstract and concrete modes of rumination process. And so to give you a couple examples of that, I put pros associated are upon reflection and strategizing how, if that were to happen again, maybe a different form of action. And then harmful effects and more associated effects are not processing through those traumas. And so the other quote I found was rumination as a diagnostic construct plays a maintaining role across a number of disorders, prompting investigation of the nature and role of rumination in other clinical conditions. And so I found this interesting just from a very cognitive approach in my job, right? I deal with a lot of trauma, and so how to better help those patients and sort of understanding where the trauma is rooted, where it comes from, as part of that process, I think is really, really important. And so there's a distinction between trauma-focused rumination as well as therapy-focused rumination. And so I think one is obviously harmful, one is not. And this becomes especially important and where I found a lot of articles relating to rumination as a form of therapy through patients exposed to depression and PTSD. So obviously there's probably more research that can go into the positive associations with rumination, but I just thought that was pretty interesting. And then the last article I'm going to talk about today was from Taylor and Francis Journal of Psychology. It happened to be out of the one in Africa, but it talks about how evidence that post-traumatic growth can occur with rumination. And this is where I didn't always think of rumination initially as a negative aspect. I thought it was just like a temporary phase where when we process through trauma, we kind of get stuck. And so the quote I found was that research findings can contribute to the evidence of post-traumatic growth, and they can be modified by social support, reappraisal interventions. And so, again, purposeful, therapeutic, mediated cognitive reappraisal of those ruminative thought process, I think, is where a patient may have them, and it can be constructive as long as it's addressed and worked through. And social supports like family, friends, they can all be involved in that process. So real quick, techniques and therapies. I think first and foremost, the most important thing with trauma is to acknowledge the trauma and accept the trauma before a patient or an individual is able to work through the trauma. This can include self-care, lifestyle choices. Trauma should never be dealt with alone. I have very strong feelings about that. And so I think supportive family and friends, even, non-biological family and friends that really provide that sense of safety and security. Group classes, educational opportunities for trauma patients, I think is another example of those group classes. Other forums can be through community. And so I put religious and non-religious groups. So common interests like hobbies, but also, religious groups for support. Sometimes that can be helpful. And then in terms of like clinicians and therapies, cognitive behavioral therapy was the most common one I saw in association with rumination as being effective. It's, I think, the process of breaking that cognitive cycle down and changing that dynamic between thoughts and perceptions and how they can be, again, maladaptive and adaptive. Psychologists, psychiatrists, and then other medical health providers. Educational surroundings, again, I think is really, really important with anybody who's dealing with trauma. And this can be at an individual or institutional level. And so then just finding those personal interests and hobbies. This slide was kind of fun. It just showed a couple examples of some ways to sort of stop ruminating. So my personal application, I found a really silly, nerdy comic slide, and it's made me laugh because I kind of think sometimes I ruminate a little bit, but more I am very analytical in my head before making sometimes decisions. And so this says, okay, let's revise some of the dumb stuff you said today. And then my brain's like, oh, well, this could take a while. And so sometimes I think I don't sleep, and I go through this process of, oh gosh, what did I do today, and how did it, transpire? Reflectively, sort of kind of think about that process, and so it made me laugh. It felt applicable to ruminating and kind of getting stuck, and where if I did this probably every day, all the time, you could see how it could be negative, and this was a comical spin. So yeah, I've experienced milder forms of rumination within my profession. Some of the traumatic cases I've seen, some of them can stick with you a little bit longer, from direct exposure to helping treat those patients. And so, as well as personally, through my son's epilepsy, it was a perfect example of where I have all this knowledge, about epilepsy, but it kind of became overpowering. And for that initial shock and traumatic experience that I went through with my son and his diagnosis, and all that, initial medical stuff, I really felt like I kind of processed like, oh, how could I have missed this? And I got stuck there, and I think that's very dangerous. And then with my own cancer, like it took a while, obviously in a constructive format. I do seek therapy just for bettering myself at all times. But, I had to recognize the control I had in the situation. And at first I was like, gosh, did I miss something? Was it my fault? And I began to ruminate, I guess. So that's why I think rumination became interesting for me. And then tips for myself and just tips for rumination in general, if you tend to have a mind that might sort of go into those cycles, is remember that things are within my control. And also some things aren't, right? And that's okay. And then find positive distractions. So when you get stuck in those, oh my gosh, how many dumb things did I say today, from the comic itself, right? Sort of asking yourself, does it really matter? And sort of finding a different positive distraction or something else to, keep your attention and focus on. Acceptance, again, all trauma has to be accepted. And I think sometimes that's hard for patients because trauma isn't an individual's fault, but you have to come to terms with it before trauma can be resolved. And so mindfulness, and then friendships, social groups, and personally for me, therapy, others as well. So awareness to rumination is important related to trauma with positive and negative components. I hope you enjoyed my study. It's been great working with everybody. My next slide is just my references, and I'd love to hear what you have to think.